Hi, I'm Dr. Monica Chadha. I'm a chiropractor and movement coach, and I'm here with the lovely Bisa Dobson. Bisa.
Hello, everyone. Happy Pride.
Pride. So in honor of Pride Month in Toronto, and we would like to actually talk about some things that come up in clinic for us. Bisa, would you like to talk about what you do?
So my name is Bisa Dobson. I'm a registered massage therapist, and I call myself a massage therapist plus because my specialty is treating inflammatory conditions like lymphedema. So for this context, I'll say I'm a lymphatic massage specialist. So I can help people who are dealing with postoperative swelling, any kind of condition in the body. I'm here to help, and I love helping people who are going through things like postoperative care.
Yeah, so that's kind of the topic we're going to discuss today is postoperative care. Whether you're considering going into surgery or going through hormonal changes, or just actually post gender affirming surgical procedures, we want to talk about accessibility of care and what types of things we can work on to help somebody who's going through that process. I know Bisa does a lot on lymphatic work, which I think is a beautiful, beautiful, beautiful thing when you can understand why that's so important post-surgery, sorry. So things like physical therapy, hands-on touch therapy, exercise therapy, chiropractic, massage can be really, really helpful for people who are going through things like chest reconstruction or hysterectomies or phalloplasties, breast augmentation, or vaginoplasty. So there's a lot that can happen in this space. And we also wanted to talk about safe spaces. I came across a post yesterday that said, rainbow things are nice, but safe spaces are better. And so I think that's really, I think that's really beautiful because, you know, we can put up all the flags and all the signs and all the social media posts. But how much more important is it that it follows along with how we're treating the person in front of us when they come in for care? We want to make sure those people are being seen, being heard. And this goes across the board for any patient going through anything. It's a very sacred process when someone comes to you to be treated. And so we wanted to present some tips and tricks for people who are going through transition or going through surgery in general, how we can help or what they can look for in a therapist. If it's not us, what they can look for when they go see somebody. Bisa, what's your experience in working in this space?
I haven't had a ton of people who've done any kind of transition surgeries, but those who I do have, it definitely is choosing a practitioner is super important because the safety piece is a really big deal. And I'm very, very conscious of that when I'm approached. What I will say, something I think about for any kind of surgery, but this surgery in particular, because it's so important and so life-altering, is that when you're going in for surgery, you need to think about aftercare at the beginning, not when you come out at the end and then you're scrambling. Like, this is really, really important. So your doctor tells you what to do to prepare before, and afterwards they download all this information about aftercare. And I'm sure some do that as well before, but really, really be conscious of getting the money together if you need to get your money together, figuring out who you're going to see, finding out when you can go in, all these things. And you always have to consult your doctor. People often ask me, can I come in? I'm like, hey, you could, but your doctor knows your health history. I just know your name. So you need to go back and ask them. But to be very conscious of the fact that you need to put the money aside, the time aside to make sure you're going to take care of yourself afterwards, because just the post-operative swelling alone for something so big could be 3 to 6 months, and often it's more when it's a really big surgery. So you need to know that you're going to take care of yourself and take care of yourself well afterwards. And I think people are so keyed up for I'm going in, they've kind of let the back end drop off until they're in it, and then they're scrambling, which is not great.
Yeah, that's a really, really good point that you've touched on. I think we get so caught up in I have to get to the surgery, all the things you prepare in advance for it. I had a few patients as well who were thinking about surgery. They were coming in to talk to me about, what's involved afterwards. And I think even just the conversation of what's involved ahead of time, being more prepared in your body for those changes, optimizing yourself as much as possible for going into surgery. That's a really big deal. I think anyone that comes out of surgery is a survivor. And so I really do think you evaded, you evaded death in that process. And then you came out of it with this result that you're really looking forward to. So it's a beautiful thing. But I think you can prepare also ahead of time, like you said, for the aftercare. There's also pre-surgical stuff that we can look at in terms of, how you mentally take care of yourself, how you physically take care of yourself, just putting yourself in a more optimal position to handle the surgery as best as possible. A lot of times what I end up seeing in practice with patients who have been through surgery of any kind, really, where they've been intubated, there's a lot of head, neck, jaw stuff that ends up happening just from the intubation process. So, looking at the jaw connection, the connection of the hyoid, and the connection of your breathing mechanics. I assist a course with immaculate dissection that goes over all of this, and they definitely touch on pre and post operative care in this region as well. And it's such a big deal. I've had actually just this past week a patient who came in post operatively and had lost their vocal tone. Like they had like a different tone after surgery, very, very screechy, squeaky, high pitched tone. And it sounded very, very effortful. And, we've been working together for a while now. And just this last week, actually starting to notice the tonal changes and the ease in being able to speak again. And that's just from the intubation. That wasn't even what the surgery wasn't even for this region, right? So you can imagine the things that we can do, or the things that you can do for yourselves when you go to physical therapy of any kind, whether it be massage, PT, chiro, osteo, whatever method you choose, just making sure your whole body's being addressed under care. I think that's a really big piece to it.
For sure. Absolutely. And what I will say is that I think people who are undergoing these kind of surgeries understand how big it is, but until you're in it, you often don't know how long it takes the scars to heal, how long it takes for you to feel comfortable, to be able to sleep through the night. So really, beyond the treatment piece, having the time to slow down afterwards and really take care of your body is so important. And I think I've seen some people rushing back into work. I'm like making sure you plan your surgery and set yourself up so you have the time to allow your body to heal and really rest and move slowly. And hopefully you have an employment situation where you can ask for those accommodations for a good amount of time. But something that's I really want people to think about. Even if you're never going to get any therapy at all, you need the time to slow down afterwards to let your body heal. Even if you're young, like people, oh, I'm young. No, even if you're young, like really, really think about that, because your body is going through a lot of healing and needs some time.
Yeah, and actually to touch on that point, I had a patient who had gone for gender-affirming surgery, and I said, how did you convince? They're really like a high-performing person in their day-to-day, and I said, how did you convince yourself to slow down? And they said, transition is never easy, nor is it ever very quickly done gracefully. So it's in the word, I am transitioning, and therefore I must take time. And I thought that was so beautifully put. I can't even myself with describing it. So that I think that was so beautiful to hear. And I will always use that with any patient who's going through surgical care. But also to touch on this, like it's a lot of information to take in when you're setting yourself up to go for these surgeries. And it might be helpful to have, a support group that you might have that you talk to outside of your appointments, but it might be handy to have somebody you delegate as your person to come with you to appointments so that maybe they can make notes that you might miss. It's a lot of stuff coming in at you at once. And so it might be handy to have someone there objectively writing things down that you might not have the awareness to do for yourself, because you're paying attention to pieces that really pertain to you in the excitement or in the nervousness, while they're sitting there thinking like, this is my friend, or this is my partner, or this is my loved one, and what would be important for their pre, during, and post care. It would be really handy to have someone there.
I talk a lot about patient advocacy on my Instagram page, and one of the things they talk about is the fact that people who have a buddy with them who can be objective. So don't have your mother; she's going to be teary-eyed and can't concentrate. Somebody who has enough distance from the situation and won't be melting themselves. Better outcomes because more questions are asked, more information is kept and written down, and patients actually have better outcomes when they have a buddy. So if you are comfortable having somebody in the room with you, or alternatively, if you're not, you can ask the doctor if you can record, which is also a great way to do it. Then please, 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 such a huge piece. Like the percentage difference is massive. I think it's almost 50% better, like so better outcomes for patients who have a buddy. So please, that's a really, thank you for saying that. So such an important piece. I think
Yeah,
we don't take that enough.
I think you had mentioned that once. We had talked about this previously at some point, and you had mentioned that as well. And I thought it was a really important piece. And the cell phone part, or like the recording part, is awesome because almost everyone has access to one of these. So it'd be handy if you like, hey doc, do you mind if I record some of this down because I won't be able to remember all of this. Sometimes what I find doctors might say is, well, don't worry, I'll send you everything. And it's like, you might not send me what I'm actually listening to. I would love to record this conversation. And if that's not okay, then next time I'm going to bring someone with me and we'll have this conversation again together. So, I think in order to avoid a repeat appointment for the same thing, they might actually let you record. And that might allow everyone in the room to slow down and think twice about how this care is going to go, which is not necessarily a bad thing. So,
Yes, we know that Dr. Devlin and I often discuss how in our practice we recognize how marginalized groups, so women, queer folks, people of color, people who have mental health issues, elderly people, people who are poor, and if you're all those things, oh my God, are often dismissed or not listened to as carefully by doctors who are often sitting at a different class level and never had to interact with somebody, quote unquote, like you in a really meaningful way. So then how they show up in the space unwittingly, lots of times, may not be in a way that's going to get you the best care. So yes, advocating for yourself, recording things, super great to do as far as I'm concerned.
Yeah, and I'm more on the advocacy piece is, I think it's a learning process for everyone, the doctor, the patient, the friend next door that's hanging out with you as your buddy during that appointment. I think everyone in those situations has the opportunity to learn to treat the person in front of them or how that person in front of them wants to be treated. So as much as it definitely is the practitioner's responsibility to treat them with the best care that they possibly can bring to the table, patient advocacy is self-advocacy of, how do you need to be treated? How do you need to be seen is very, very important. And I think that's a big learning process for us as patients, is knowing what works for you in those situations, what kind of care you feel you need in those moments, and how can you convey that to the person, the practitioner in front of you, to be like, okay, this style doesn't work for me. I need you to, are you able to like meet me where I'm at so that, I'm able to take in this information better, or that I can get better care from you because I feel like you're a great doctor or whatever you are, right? But I need a different kind of care in this moment from you. So I think it is a definite like play back and forth between patient practitioner and how they can learn to better coincide with one another.
Yes. And I think that for a long time, though I think it's shifting with younger generations, the doctor was seen as the authority or the practitioner, period. And then you were just coming in and absorbing what they're giving to you. I think there's a little more back and forth that's happening in some really positive ways for people who are accepting of that. So yes, advocate for yourself. Don't be shy. And if you are shy, bring a buddy who will not be shy and help you out in that regard. It's really important for your overall health. And I just want to say very clearly about what I do as far as the transition piece for people is so the post-operative time when you are dealing with all that swelling, once your doctor says it's okay, that has to happen, your doctor has to give you clearance, you can come in and see somebody like me who does lymphatic massage to help reduce the swelling, which of course reduces your recovery times and also reduces the pain you experience after treatment. And I just want to say very clearly, designation I think the people you should see for this should have. So I am an RMT, and also I have a second designation, which is combined decongestive therapist, so CDT, combined decongestive therapy. Anyone who has the designation will be great for you to see. So those are nurses, physiotherapists, OTs, depending on how you're going to see them in the hospital or otherwise. But those are the type of practitioners you want to see to help reduce your swelling. There are lots of people who do lymphatic massage. Not all of them are as qualified as they should be, I think, for it to be safe and effective for you. So be sure to make note of that as well. Make sure you're getting the best care possible.
Wonderful point. And to speak on that a little bit with in terms of post-surgical care, both techniques, chiropractic, massage, can be really great for facilitating healing, decreasing pain, and regaining function. So looking for somebody who helps you with that functional part is going to be really important, because once you've gone through those changes, you have scars that develop or that you're working through, you're also changing how you might move post-surgically because of the areas that are affected by the surgery. And depending on what you've had done. So, making sure that the same post-operative care that goes into any other type of surgery that you have with rehabilitative expectations is taken care of here as well. So to help you regain function, I've worked with patients on things like helping them improve their movement ability, helping them regain control of their trunk and their arm mobility afterwards, because there can be a lot of discomfort there with chest reconstructions. Things like hysterectomies can help resolve some of the pelvic floor things with therapy. That's what I work on with patients who've had those. Same thing with phalloplasties, any pelvic floor issues that can come up in those places. It's really, really important that gets addressed and not left behind, because it can develop into, more annoying and possibly bigger issues down the road. So you definitely want to be able to regain movement ability in those areas, using a combination of hands-on therapy to release any tight structures, but also teaching you how to be able to release those areas on your own, and then re-coordinating the musculature in that area is going to be key. So definitely looking for therapies that allow you to decrease the swelling, decrease the pain, but then also improving the mobility and function of those areas once you've gone through and once you have the clearance from your surgeon.
Excellent points. I agree. Is there anything else you wanted to talk about regarding this subject matter before we head off?
No, I think we've covered quite a bit together. Definitely would love to jump back on here for a different topic of the same theme later this month.
More pride, please.
Yes, pride, please. Well, thank you to whoever's popped in to watch this today. And hopefully, if you have any questions, leave them down there or contact us directly if you'd like to have some private questions be answered. But thanks, Bisa.
Always happy to take questions.
Awesome. Thank you.
All right. Thank you so much for your time.
Thank
Have
you.
a wonderful day. Thank you for watching. Bye.
Bye.